Hello, let's talk about the O-shot procedure. It's used both for urinary incontinence and various forms of sexual dysfunctions in females. The O-shot is the same thing as the orgasm shot. They are both trademarked and protected by U.S. and patent trademark law. Yes, I was the inventor, am the inventor, the first person to ever do the procedure ever anywhere on the planet. But all of these physicians have been key to developing the procedure over the past 3 years. Dr. Roy went nationwide on Fox News, has a book coming out. Dr. DeBourbon, Dr. Tess Mauricio, America's favorite dermatologist, Dr. Melnick up in New York City, an infertility physician, Dr. Samuel Wood, infertility physician, OBGYN, Dr. Skelchak, an amazing dermatologist, Dr. Kiefer, Dr. Mercado. All those physicians have been key in both educating the public and doing this procedure and gathering data, preparing and collecting for clinical trials. Now, I started off as a research chemist, and some of the instruments I worked on are still used by the U.S. Armed Forces in protecting our freedom. But I also did clinical trials as a physician, and I published the best-selling Sex Man on Amazon, or at least was, for 2004. Around that range, I invented the vampire facelift, which was key to this procedure. Because with a vampire facelift, I could see how growth factors could be used in the face and treated this young woman, Laura Ezekiel, who was the first woman to ever have an O-shot. And I want to give her credit because although I was considering the ideas of how to rejuvenate vaginal tissue, because she had delivered 3 babies, she wanted the procedure done and was the first woman brave enough to have it done. Now, why even talk about sex? I think it is so critical, so important. You must not forget that sex is important. Why do people get criticized for improving their sexuality, but they don't get criticized for waxing their car or painting their house? Vaginal tissue is just as important as heart tissue or bowel tissue. And we can talk about how to have a better bowel movement. We can talk about how to have a better urinary flow or a better sexual experience. And the poets and the thinkers have all talked about how sexuality helps our prosperity and our creativity and our families. So here are the problems: sexual dysfunction and urinary incontinence. Talk about sexual dysfunction first. Here are the 4 main categories of sexual dysfunction, almost word for word from the Green Journal or Obstetrics and Gynecology, which is like the Bible for gynecologists in the United States. Those are the main problems. And if you add all the statistics, conservatively about 40% of women suffer distress. If a woman's not bothered by not having an orgasm or not bothered by not having sexual arousal or desire, she does not get counted. So 40%, that's the number of women, about 50 million women in America, who are distressed, and they don't talk with their doctors. Research shows only about 14% ever talk with their doctor about sex. And they usually don't tell their husbands because they're afraid they're going to hurt his feelings, or their sweetheart, their lover, if it's a man or a woman. They often don't talk about it because they don't want to hurt their lover's feelings. So they go suffering. And here's a good example. This is one of the first women I treated, 36-year-old, difficulty having orgasm, putting up with a relationship she wasn't too proud of, really not enjoying, because she had dyspareunia, painful intercourse. And even though her hormones were normal by the most strictest, most up-to-date standards, she still had almost no libido because she was having pain with intercourse, and there was nothing, everything had been tried. She literally had this callus on her clitoris from a vibrator that was so powerful, and it took her so long to have an orgasm. She literally developed a callus on her clitoris. What would you tell this woman to do? There is no treatment for this woman until there was an O-shot. She felt in her 30s hampered in her ability to develop a relationship, and it goes on all the time, every day in your neighborhood, in women who have had big babies. They have a 10-pound baby, the vaginal tissue's torn, now she's leaking urine and pain with intercourse. So this is an important procedure that must be talked about. Now, do we really need a better way? Yeah, we just talked about how prevalent it is. Well, why has it been solved? People have tried, they've tried hormones, but not all women need hormones. And there's really nothing else. But what have they tried for the urinary incontinence part? Well, they've tried injecting other materials. One of them is coaptite. I want you to see this material just so you'll know. I was not the first person to think of injecting something into the vagina. Coabtite is FDA approved to inject in the vagina for urinary incontinence. And if you look at the complication rate, yeah, it's a material that has helped a lot of women, but you have retention 41%, they get dysuria, they get infection almost 1 in 10. And look at what's used to do this procedure. It's like a nail. It's almost like a freaking nail. Look at that. And this is put on into the vagina next to the urethra to help with incontinence. Now I want you to look at what we use when we do the O-shot, these tiny little needles. So this is FDA approved. This is not an FDA jurisdiction because we're not using a drug. We're not even using a drug. There is no foreign body. We're rejuvenating the woman's tissue with her own growth factors from her own blood. So let's go back and talk about this, all right? So we'll talk more about how it's done and where it's done, but let's look at the incontinence component of it. Urinary incontinence, there are physical therapies. Kegels, yes, they help somebody. You can be dehydrated. You can go to the bathroom every 30 minutes to keep from urinating on yourself. But what if you have a job where you stand on your feet all day? You're a massage therapist, or you're a waitress, or you're an ER physician, and you're a woman who can't just be running to the restroom every 30 minutes, and you need to stay hydrated for your health, and the Kegels haven't worked. What do you do next? The next step up is anticholinergic drugs, which cause you to be dehydrated, constipated, and if you're an older woman, trouble thinking. So, and even can flip you into dementia. So the next step is injections, which I just showed you, coabtite, and surgery with a sling or a mesh, and all of these things will still stay. There will always be a need for physical therapies, for anticholinergics, and for surgery. Maybe not coabtite, but if you have a structural abnormality and you need a mesh, you need a mesh. Even though there are complications, most women who need a mesh, they need a mesh. If you need a sling, you need a sling. But there's a huge gap between physical therapies and anticholinergics where there is no good therapy. In other words, if a Kegel hasn't worked, most women don't want to jump all the way up to something as invasive as an anticholinergic drug or that nail you just saw in that video being put into their vagina. So all this procedure does is offer another way. Now let's talk about how it's done. Now this, we made some nice press in Harper's Bazaar. This has been all over the news, so some of you may be watching this video because of that exposure, but let's talk about exactly what's different and what can be done now. Platelet-derived growth factors have been around for a long time. Athletes have used them. Veterinarians have used them for the past 10 years to help the knees of racehorses. NFL uses it to get their athletes back on the field by putting it into the knee. The dentists have used it for oral surgery. Any hard-to-heal wound, and all you do is you get the platelets out of the blood using a centrifuge, and then you activate those platelets, and at least these growth factors are released. You can measure them in the blood and in the tissue a week later, and it stimulates basically the cells, the seed cells in the tissue that are there so that if the body's injured, it grows new tissue. I think for a good explanation of that, let's watch a video where I give an explanation of that on the news. So here we go. Let's watch this little video and you'll hear me explain.
The inventor of the O-shot, Dr. Charles Runnels, talked to WCMH about how it works.
Remember when you scuffed your knee as a child and there's a scab there and there's this yellow goo there? That yellow goo is what caused the skin to regrow. And there's a way to make that in about 10 minutes by drawing your blood.
Basically, once your blood is drawn, the platelets are injected with some calcium and form that yellow substance. It is then injected into the vagina to rejuvenate and create more cells.
So that's what you're doing when people have the O-shot done. That is what they're having done. So let's go back and talk about it. So once that's injected using that tiny little needle you saw momentarily a few minutes ago, it's like putting fertilizer on these dormant cells. It's like you have an apple seed that just lies on the table and nothing happens. But if you put it in rich soil and you water it and fertilize it, now it grows into a complete tree. In the same way, if you have these stem cells in the vagina that are lying dormant, when they're stimulated with growth factors, or in the face, like with the vampire facelift, or in the knee, like the orthopedists use, or in the mouth with the dental surgeons, or in the sternal wound, in the thoracic surgeons, all of whom use this method, it stimulates all the tissue, just like this apple seed grows the whole tree, the bark, the limbs, the roots, all of it. These stem cells grow the whole entire tissue of of wherever they're stimulated. So in the face, they grow fibroblasts and collagen and new blood flow and new blood vessels. And they're doing the same thing in the vagina. So, here's an actual study, a nice study where they injected in the back of the arm and then they biopsy the arm periodically to prove that new tissue is growing and no abnormalities, because it actually has part of the function of the growth factors is to fight infection and to fight abnormal cells. So the tissue becomes healthier. This is used to treat scar tissue. It's used to treat scar tissue. It's used on the face after lasers to help prevent scar tissue. So to be worried that somehow plasma is going to cause harm is like worrying that somehow giving someone oxygen is going to suffocate them. Plasma, the platelet-rich plasma, prevents scarring. It treats scarring. It prevents infection. So, here's where I use it in the breast. This was 2 months after in a procedure called the vampire breast lift, where we put it in the tissue and rejuvenated the tissue. Thankfully, she had scars to prove it was the same woman. This is used all over the body. So where's the shot done? Well, people have talked about the G-shot and the G-spot, and the G-spot is basically, people aren't really sure what it is, but basically Dr. Grafenberg, for whom it was named, thought the urethra was the most sensitive part of the body and talked about how to stimulate the urethra, which you see there in the top tube, by pressing on the roof of the vagina where it's closest to the urethra. And the G-spot has been talked about various structures that might be involved there, but there's no discrete structure. Where we actually, although some people say it might be with the Skene's glands, those little green things you see there, which secrete the fluid that's released from the body when a woman has an actual ejaculation. And that fluid actually tests positive for prostate-specific antigen, like in a man. So it's like the vestige of a prostate. That space, you see that white space between the urethra and the vagina? That space where those glands are. That's where we put it. And there's not a name for that space, so I named it the O-spot. And the O-spot is just that empty space there. That's what we call it now, the doctors who do the O-shot. That's where we put it, in that space. And there's so much fluid put, it just spreads everywhere. You don't have to be to the millimeter where you are, because the fluid, because it's plasma, spreads beautifully well. But you do have to know what you're doing to get it in the area where it spreads in the right direction. So there's something to be said about knowing where to do it. And also, look at this picture. Most people don't know about the hidden part of the clitoris. When you're looking at the clitoris, you're only looking at that pink thing as the entire clitoris, and most of it is inside the body. When you look at the clitoris, from the outside, you're just seeing the tip of it there, which is like the glands or the head of the penis. But when we inject this material into the clitoris, and we use a numbing cream, so the woman has, if any pain, some will have some pain, but if she has pain, it's usually very minimal because we use a very strong numbing cream. I never tell people you're never going to have pain, but most people do have, if any pain, they have very little pain, and most people have no pain. So we use a numbing cream. Some of us use ice, just like when you get your ears pierced, the nurse holds it on there. Then we put a little shot in there, and if you have any pain, it's gone within a second. And that fluid just flows beautifully. We think, we can't see it, but the clitoris does not expand, and it's got to be going somewhere. So it's like injecting a sponge. It just flows through the clitoris, and that inner part of the clitoris is critical. It is critical by ultrasound studies in women who need to have a vaginal or want to have a vaginal orgasm. That inner part of the clitoris is very important to that, and we have women that are having vaginal orgasms, multiple orgasms, ejaculation for the first time in their life in their 60s after having this shot. Now, so we think all those tissues are being rejuvenated, and as an example, the woman I showed you earlier had the callus on her clitoris. Within a month, she went from having almost no orgasms, it took a long time with a powerful vibrator, to being able to quickly have an orgasm. She felt more able to connect. She dumped the old boyfriend. Within a month or so, she was engaged. Within 6 months, she was married. And not that that's the goal of everybody, but the point is, this woman changed her whole life because she was able to experience sexuality again and felt like she could become close, and did become close to a man that she was that was just not possible for her until after the shot. So, this is an important procedure. So if you want to have it done, here's some things to do. If you go to the main website, oshot.info, let me show you what all you can find there so that you can find what you're looking for. And not everybody's looking for the same thing. So if you go to OSHOT, you just type in your browser, oshot.info, I-N-F-O, oshot.info. When you get here, you scroll down, and here is where, if you want to find a provider, that's where you click. It's on the page several times. You can find a provider. If there's a long video there that tells you about the procedure, that's a video that shows you how the blood is prepared. We use FDA-approved kits. Once you prepare blood, it's not a drug, and it's not part of the FDA, but all the doctors who use the Vampire Facelift name are using an FDA-approved kit. In other words, it's a kit that has been approved by the FDA to prepare blood in such a way that it's sterile and it's able to isolate the platelets such that they can be put back into the body. And that's important that the FDA check out these devices. Once the blood's prepared, then what it's done with therapeutically depends on whether you're an oral surgeon or a plastic surgeon or a dermatologist or someone doing sexual medicine in this procedure. If you want to read more about it, you can go here and read this book for free. If you have a Kindle, then you click on the Kindle version of it, and then you can borrow it. Here we go, where it says Lending Library. You can borrow this book and read it for free, and it tells details about how the procedure works and how it came to be. You can also just read on the OSHOT website more about it. If you're looking for a sex educator, or if you are a sex educator, then there is this, where we have sex educators listed who understand about the procedure. If you want to be on that list, then you can apply to do that on that page. Here's where you would find a physician. This is where physicians would apply to be able to provide the procedure. And if you want to apply, of course, we need to know how to contact you and check you out to make sure you're a legitimate physician. But we have physicians around the world doing this now. If you want to read some of the research to prove that this is a viable procedure and to see some about it, here's me lecturing about research that has to do with platelet-rich plasma. Some of the more important scientific references are here, as well as in that book, which again, you can read for free if you have a Kindle on Amazon.com. So let's see, I think that's about it. Providers, video page, free info, educators. Let's see, I think we're getting to the end here. Yep, that's the free Kindle book. Oh, lab testing. This is not some magic shot that just fixes every problem. If you are postmenopausal, or even if you're not, especially if you're on birth control pills or if you've had head trauma, you might want to have some real blood work done by someone who understands how to check out every one of these tests, and you should have every one of these tests done if you're having sexual problems. Then the person who sees you will do, it's not just a shot. You come in and get a shot. They have to think about you. And that's hard to understand why we should pay people to think, but it's the hardest part. Knowing how to prepare the blood, having the very expensive equipment that's necessary to prepare this blood, understanding how to use it, and how to think about the whole woman. Now, some of the people who do the procedure may refer you back to your gynecologist or to someone else who understands how to interpret these tests. They may refer you to a sex educator who both understands sexuality and this procedure. And all those, it's like a team sometimes to take. Sexual problems are not always easy to solve. And so sometimes it takes a team of people thinking about you. It takes a team of people sometimes to paint your house. If I get my car washed, there are 2 or 3 people. One's doing the tire, the other is washing the hood. It's just not a big trick. You should be thinking about using more than one person as a team to think about your health. So as far as the trademark, this is critical because it's very important. Blood, any doctor can buy a centrifuge, and if they're not using an FDA-approved kit or they don't know what they're doing with the blood, then they're tricking people. And the trademark is owned by me. I want to make sure you know this, and this is so you can't be in people's offices and force a patent but I can keep track of who's advertising something. And if someone is advertising something illegally that's a trademark name, then that's illegal and it's tricking people. So it gives us a way to keep track of who's doing things. And if you go to USPatentandTrademarkOffice.gov, click on trademark search, and then you click on basic word search, and you type in OSHOT, and then you search, you'll see that the OSHOT is registered. It's a true art. It's registered under my name, and it's registered there because I was first to use it, first to do it, first to use it in commerce. And why that's so important is someone has to own it to be able to enforce it. And the doctors who are listed here, all these physicians, if you say find a provider and you go here, all these physicians have invested their energy and time. You can see we have several countries and we have a lot of states, and all these doctors have invested their time and energy. There is no drug to support this research. I mean, no drug company. And so all the research is coming out of the pockets of the doctors that are doing it. And so if you go back and you look at this list of all these doctors, yeah, all these doctors are contributing. They're all thinking, they're all spending their money, they're all getting on the news. They're all passionately doing this because it works. Because not every woman, not everything works anywhere. Not everybody gets well when they take an aspirin. Not everybody gets well when they do anything. But the large majority of women who have this procedure get better, and they really get better to the point that it changes their life. So all these physicians here have been key for the past few years in helping me develop it and bring it out. And all these physicians on this website are committed. They've all been trained. They're all committed to working very hard to bring you a very nice procedure. And back to the reason for the trademark, if something happens that some doctor who doesn't know what they're doing decides they want to use the name, then now, because of the laws of the land, we can enforce that.